Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. All right, Shauna, tell me what's going on with your mid-back.
It's aching and the muscles just feel like they're constantly working really hard and that they're pulling me to the side a little bit.
It's like a muscle spasm?
Yeah, it's spasming and I can just constantly feel it whenever I'm sitting up or standing up.
So that's a constant pain? How much from 0 to 10? 10 is emergency room.
I'd say 5. It's quite annoying.
So 5 out of 10, constant pain. And what kind of pain? Is it sharp, dull, aching?
Aching, muscle burning, and it's just, it's hard to describe. It's not dull, it's
just constant nagging.
Yeah, it's just constant aggravation.
Where do you feel it exactly?
Right here.
Just that spot?
Just right here, yeah. Yeah.
So tell me how you hurt yourself, how long this has been going on?
For around 2 weeks, like gradually I noticed it was feeling tighter and tighter in that area and it started to get painful. Lots of bending over, lifting things off the floor, not always using, good posture. So pretty much that and just always, a lot more standing and sitting than I'm used to without back support.
Without back support. Yeah. So have you had any treatment for this before? Nope. Okay. All right. So so constant pain, can we do any motion that's aggravated or just it's constant?
It's just constant, yeah, just anything upright. Yeah.
Okay. All right. Let's be okay. So you feel like it's around here,
yeah.
It
feels like a guitar string.
Guitar string, that's a very good example. Because it's a good description actually. Yeah, I don't feel that here.
Yeah, that side's fine. It's all on the right, right
by
the spine.
You can feel that here, like a...
And a little higher too.
And right in here too.
Like right here. You can go boom, 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 strum it.
Oh,
you can strum it.
There you go. That's the spot, yeah?
Strumming the guitar.
I found it, okay?
Yeah.
All right. So let me know if that's painful, okay?
Okay.
So do you know why it's feel like that?
Do I know why it feels like that? Yeah. Because my bad mechanics. Okay. I kind of deserve it.
Yeah. Shauna, you are a physical therapist.
Yeah.
That's why I'm technical. So it's that feeling of a string and like a kind of like band. That's the epimycin or the premicin is actually when it's tight, it compresses on the fiber and give you that feeling.
Yeah.
So the epimycin, the premicin, these are like fascia layers. That's wrapping the epimycin, wrapping the muscle. The premicin, it's a fascia layer that's wrapping muscle bundles.
Yeah, right there.
Is that too much?
It's a little painful.
Sorry.
Oh no, it's okay. But that's definitely the spot though. That's definitely
make sure it's not aggravating your symptoms, okay?
Okay.
Is that too much?
That's okay.
Make sure it's not painful, okay?
Yeah. That's definitely the spot though.
How does this feel now?
Still pretty tight.
Very tight?
Yeah.
You feel it right in here?
Yeah.
This one?
Yeah.
Okay. You know if it's too much, okay?
Okay.
So you're injured with a lot of lifting?
Yeah, light objects, not even heavy stuff. Just constant picking up things off the floor.
Like poor mechanics and something like that.
Yeah, I think I was just using my paraspinals. Yeah, I shouldn't use technically.
Okay. Is it okay I will have you lie on your stomach?
Yeah.
Head there.
Head over here?
Yeah. And make sure you let me know if you feel any pain, okay?
Okay. Yeah, right there.
Too much?
Yeah, a little.
Sorry.
No, it's okay.
What about you?
Yeah, that's perfect.
So what I'm looking forward is actually the thickness of that string
Mm-hmm.
to decrease, like the fullness feeling.
Mm-hmm.
You know what I mean?
Yeah.
To like to be less full. Until you get rid of it, okay? See how far this up and down. Because this could be like through your paraspinous all the way up.
Mm-hmm.
And it's actually, oh, yeah, it's here. You feel that?
Yeah.
Okay. So we have it more here. Too much?
No, it's okay.
Make sure you breathe, okay?
It feels like a CPR, but like backwards.
Yeah, that's a good description. It's gonna feel cold, okay?
Okay.
And I have lotion. Is it okay? Probably
of
I'm
course.
gonna mess up your clothes.
Oh, it's fine.
It's fine? Okay. Sorry.
It's okay.
Let me know if it's too much, okay?
Mm-hmm.
Is this affecting your breathing or it's okay?
Nope.
Okay. Any lower back issue?
No, it's just that one spot.
This one, okay.
It's like one long.
Band.
Yeah.
Yep, that's what I feel here. Relax your shoulders.
Okay.
Yep. Mm-hmm. I really made a mess.
It's okay.
Okay, don't look back, okay?
Okay, it's okay. I'm gonna take a shower anyway.
And here your tears, mine leisure. Feel that?
Yeah, I'm tight everywhere.
Mhm. Do you do any exercises?
Not very consistently, but you know, I do, you know, like scapular retractions and
Mhm.
you know, external rotation.
Mm-hmm.
Try, you know.
Okay. I'll get to here. Okay. Everything's okay. Oh wow.
Yeah, traffic was very, like, not heavy. I was like, oh.
Okay. From LA?
Yes.
Alright. Okay. Is that too much?
Don't feel it. Yeah, that's good.
How does it feel now?
Let's go ahead and do this next.
Still kind of bandy.
Mm-hmm. But the tightness, the pain, do you feel
It's
it?
less. It's less.
Less. Let me do a couple
Shauna,
of
is that
things
behind with
here.
your purse?
Okay.
Oh, you can move it.
Oh, so
It's
cute.
gonna feel cold.
Okay.
So cute.
Okay.
No, it's alright. I've been listening to some. So I know. Remember this one?
Oh, yeah.
Okay.
And then the next
I'm
one.
working on the superficial fascia and the deep, the apparatic fascia.
Oh,
So the fascia system is like, fascia is like a wrap surrounding the entire body. That's one layer, the superficial layer. So we have superficial layer and we have 4 subcategories for the deep layer. So the superficial is wrapping the entire body, very thin layer under the skin wrapping everything. The apparatic fascia, it wraps a group of muscles. And then you have the epimysin, it's wrap each individual muscle, and you have the premiysin bundle of part of the muscle, and then the endomysin. And that's what I try to release, because when you have any tightness with any layers of this fascia, it's gonna squeeze the muscle. So it's gonna cause that band feeling or, you know, string feeling. And this is, I'm working on the apparatic fascia. Feel how tight is this?
mm-hmm.
Have you had any head trauma?
No, not yet.
Back injury?
No, this is my
Are you
first.
planning?
No, this is my first time ever having back pain. It's
Okay,
I guess it's well overdue.
that's good. Did you had any stomach surgeries or anything?
Never had a surgery.
Okay. How does it feel now?
It's still a
How much
band.
tightness? I know the band.
It's better.
0 to 10 now?
I'd say more like a 3 or 2.
Okay, so went down a couple. Okay. Sometimes I don't expect the entire band is go away in one treatment. As long as the feeling decrease,
Yeah.
you just might need a couple of treatment to work on totally release it. Is that too much?
No, but that's like the perfect spot though.
Okay. There you go. Definitely feel more mobile. Okay. This spot here. Too much?
Oh, that's good.
Mm-hmm.
No space for exercises.
You have the hallway.
The arm leg.
Oh, okay. Yeah, sorry. No, goodness. How does it feel now?
Is next.
Oh.
0
Like
to
it's-
10?
When you push on it, it's still painful,
Mhm.
but not as tight as before.
Okay. Let me do something different, okay?
Like if I like do stretches
Line
and
your
stuff.
back.
Oh, okay.
Yeah.
Like if I do stretches, will that help or not really?
Well, based on the studies,
Oh,
not.
lie on my back.
Yeah.
So I'm gonna
You're
look
right.
for the mirror.
So, based on the studies, actually, stretches cause inflammation.
Oh, okay. Because I've been trying to do like
Because-
child's pose and like stretch.
Because think about it, you have a scar tissue and you have tightness. This is normal muscles should act like similar to rubber band,
Yeah.
contract and relax.
Mhm.
So when you have a scar tissue, you have another rubber band. So when your muscle, when you
Yeah, stretching
Stretch-
part
you
that's already
stretch,
stretching.
are you breaking the scar tissue? You're not gonna break the scar tissue this
Yeah.
way. But the problem with the stretches is if you overstretch,
Mhm.
it gets snapped. It
Yeah.
causes micro tear.
Yeah, I don't
Actually,
want that.
studies showed that you cause you get more inflammation flare up from overstretching.
Mm.
So it's better to get in, break the scar tissue or release the fascia. And when you break the scar tissue, there's no reason
Yeah.
this will be tight.
Okay.
Is it okay to work on the stomach?
Oh yeah, of course.
Have you had any GI issue?
I
Is it
haven't-
ticklish? I'm not trying to tickle hair, okay? That's not my goal.
I have like a dairy allergy, so
Okay.
like it gets really inflamed if I have dairy.
Okay, did you have dairy lately?
Not lately.
Okay. So, yeah, it's not a ticklish treatment, sorry. You feel your fascia?
Yeah, it's
Yeah.
weird. Yeah.
So I'm gonna do visceral release now.
Okay, cool. Never,
Have you heard
never.
that before?
No.
Did you guys have that in school? Did you talk about
We had to talk about it, but we didn't really do that much, you know,
Yeah.
like lab wise.
Yeah. Is that too much?
It's a little painful.
Sorry. Make
That's
sure you
okay.
tell me, okay?
It's okay.
Okay. Make sure it's pain-free, okay? Too
It's
much?
a little painful.
Sorry, what about now?
Good.
Make sure you let me know.
Sorry, I'm like running around.
There you go. This.
A little painful.
Sorry, okay, we'll do the one. Too much or it's okay?
No, it just feels weird that there's like an object there.
But you feel the tightness, yeah?
Yeah.
Okay.
Like, why would I be tight there?
This posture
Oh.
and inflammation in the gut,
Mm.
dairy, inflammation.
Yeah.
So you will have internal inflammation there, so you start to have muscle spasm, you tighten up, you start to
Oh,
have
okay.
fascia restriction.
Okay.
Why I'm doing this?
Yeah.
Because it's your back, it's the
Yeah.
that's the
Yeah.
agonist.
Mhm.
And the antagonist, if the antagonist tight, it's gonna your
Okay.
agonist is not gonna work.
Yeah.
Does that make sense?
Mhm. A little bit.
Sorry.
That's okay.
You feel the mobility now here?
Yeah.
Still have some work to do. You really have inflammation.
Yeah.
That's why you're not tolerating a lot of this. does it feel now?
Thanks.
I'm like trying not to use my abs. Relax. It's hard.
All right, sit up for me and tell me how's your back feel.
Okay.
I'm not expecting that rod like band will totally disappear.
Yeah. No,
Because
it feels,
we have to work
it feels
on
better.
Do you feel tightness there, the pain there, or it's gone?
Can I bend over?
Sure, yeah.
It feels better.
0 to 10.
Like a 1. It's just very,
Can we get
very,
some more?
very mild.
Yes.
Yes.
Let's say yes. Yeah. 1.
Yeah, like a 1. It's
Where do
just
you
very,
feel it?
the same spot, but it's a lot better.
Okay.
It's just,
So let's actually lie on your back. We'll get you some more. Again. One more thing. Head over
Oh.
there.
yeah, lie on my back this way.
Feel my hand here. I
Mm-hmm.
want you to push it down.
I actually feel more on the left now. So that's a good thing. Right?
But I did not work on the left.
I know. So that's,
Yeah,
that's a good thing. The
because
right is better.
You start to realize this is neutral now. Relax. You start to compare, like release area from non-released area. I get this a lot. The other side, because patients start to realize, oh wow, this is loose now.
Yeah.
Now the other side feels tight.
Yeah.
Okay, push down. Relax. Sit up, and we'll get you
Yeah,
some
it feels
water.
a little on the right where your fingers were.
Mm-hmm.
Wait, what do you want to do?
Drink some water.
Oh, I can do
I
that.
want you to tell me how much after. From 0 to 10. Don't step on it. Okay, thank you. 0 to 10.
It feels good.
Mm-hmm.
Yeah, I would say 0. Like,
It's good. We'll have you dance.
I know.
That's good. So, what do you think about the treatment?
I think it's really good.
Yeah.
I wish I could do it myself.
Yeah, well,
To
when you take the
myself.
class, you'll do it.
Yeah.
Yeah, awesome.
Yeah, thank you.
Yeah, you're welcome.
Yeah,
Thank
good.
you. Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.